Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clements B, I am going to teach you on how to carry out abdominal examination. Let's take for example that during nursing and midwifery examination, and of course instruction I'm going to say is one of the exams that came out like a year ago. Perform abdominal examination of this patient with distended abdomen. So in case you see this kind of question during examination, don't be confused. Just sit back and watch this video till the end. Do not forget to like, share, and subscribe to my YouTube channel and at Nurse Clements B. And thank you for your shares. Thank you for your comments. Thank you for watching all my videos. I love you all. So let's go ahead and then perform examination of a patient with a distended abdomen. So during examination as a student nurse or a midwife, you are asked to carry out this kind of examination. The first thing you will do, of course, you have to introduce yourself to the patient, greet and introduce yourself, and then make sure that you are carrying out the examination on the right patient, right? Identification of patient is very, very important. But what is distended abdomen? Abdominal distension occurs when substance such as air, gas, of course, fluids accumulate in the abdomen, causing its expansion. That is it. That is abdominal distension. So let's go to the patient and take. Good morning. My name is Nurse Clement, and I'm here to check your abdomen. I'm going to do abdominal examination. So please, can you tell me your full name and your date of birth? Now, the patient may say, this is my name, blah, 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 blah. Since I confirmed the patient told me his or her name, then I'll go through my folder and check whether this is the right patient, right? Be it during examination or in the normal practice in nursing, of course, identification of patient is very, very important. So you have to do that, right? So I have identified my patient now. So I'm coming to perform this abdominal examination on you. Do you want to go and empty your bladder? If the patient wants to empty his or her bladder, if the bladder is full, please permit the patient to go and empty his or her bladder, or you serve bedpan if the patient cannot move out of the bed, of course. During examination, they may indicate a helpless patient, of course. They may indicate a helpless patient. If they indicate a helpless patient, you have to serve bedpan to this patient, right? So I am coming back with my equipment to perform this abdominal examination on you. Is that okay? So I've taken informed consent from this patient. So I am going to perform hand hygiene and don my glove before I will come back to this patient. And I have performed hand hygiene and I have dove my glove, so I can go right ahead. Of course, you need your requirement. All you need for this examination is your stethoscope, your hands, gloved hand, right? That's all you need. That's the requirement for this examination. It is important that you adjust the head end of the bed like this to 45 degrees. So that you can perform this. The patient should be in a supine position like this and maybe 45 degrees, or you can lay the patient straight on dorsally, right? So, and you can also you can stand at the right hand or the left hand of the patient, right? But preferably depending on your dominant hand, right? Before you do that, you have to ask the patient, are you having any abdominal pain? Do you feel any discomfort on your abdomen? So you have to confirm from the patient. Do you feel any pain? Do you feel any pain, right? If the patient says no or yes, then you continue. So it will help you when you are writing your report, isn't it? You expose the sites that you want to perform this examination, right? So now I expose my patient's abdomen. After exposing the patient's abdomen, then you have to what? The first thing that you would do is to do inspection, percussion, and auscultation, right? So we are going to start with inspection. The inspection, you have to observe. So you observe the general contour and shape of the entire abdomen, right? And the wall while the patient is still in this position. While the patient is still on this position, right? So, and also you inspect the skin of the patient you observe the skin around the abdomen. Is the abdomen, the skin around the abdomen discolorated? Is there any discoloration? Is there any striae? Is there any stretch marks? all this you note, you observe them. Is there any surgical scar on the, maybe the patient had laparotomy, appendectomy, is there any surgical scar around? Then you observe the general appearance of the skin and any other observation you made on the skin, on the abdominal, on the skin of the abdomen, right? You also observe, is there any engulfed veins around the abdomen, Also, on the physical inspection, you should also observe the motion as the patient breathes in and out. As the patient is breathing in and out, you observe the abdomen too. And also ask the patient to cough for bulging of hernia. Is there any protrusion of any organ in another organ? So you ask the patient to cough, like if the patient is coughing, then if there is any protrusion, if there is any bulging or hernia of any organ, you'll be able to know, right? So you ask the patient to cough. So can you cough? Remember, this is a dummy, right? So the patient cannot cough. These are some of the things that you will observe during the inspection of the abdominal wall, right? So then place a stethoscope over several areas of the abdomen for the presence of bowel sound. I will use the stethoscope to listen to the sound, to listen to bowel sound. So I'm going to use the stethoscope, right? And when you are using the stethoscope, make sure that it's functional, right? You put the earpiece in your ears. Put the earpiece right in your ears and check the diaphragm, whether it's working. If the sound is low, then you turn this side and check whether, now it's louder. Then you put around the patient's abdomen. So now I am going to percuss, right? So I put it around the abdomen to listen to bowel sound. You can take it on your time also, and like from the ascending column, you can do transverse, descending, and then the sigmoid colon. You will hear, and you come to around the small intestine to hear bowel sound. You may hear the bruise twisting sound around major arteries. Remember, I mentioned that if you want to perform this kind of procedure, I said that you should do inspection, auscultation, percussion, and then of course you have to palpate, right? Of course you have to palpate to feel if there is any abnormalities in the organs. Is there any organ that is inflamed? Is there any organ normal? You can also dictate hernia in the way while you are palpating. So the next thing is for me to palpate, right? Then you use your hand, do some slight palpation while the patient is still lying down. While the patient is still on this position, in a supine position with the head and knee supported, press the abdomen slightly, right? Press the abdomen slightly in all the 4 quadrants, right? Press the abdomen slightly. Then you are palpating, right? You are palpating to feel the internal organs, whether they are engulfed, whether there is hernia, or whether there is pain somewhere, right? Then you perform, after the slight palpation, then you use your hand again to do deep palpation, right? You do deep palpation by placing flat of the hands on the abdominal wall and applying pressure. Remember, the first one I did is slight, right? Slight, isn't it? But this one is deep palpation. You have to feel deep palpation. Let it be deep a bit, applying pressure at the 4 quadrants of the abdomen, isn't it? You did do deep palpation. To also palpate the abdomen for tenderness, right? Whether for tenderness, you have to palpate the abdomen. While you are palpating for tenderness, also remember to be able to describe where you have felt the tenderness around the abdomen, isn't it? While you are doing deep palpation, the location of the tenderness and the patient response. For example, if I perform deep palpation here and the patient feel pain While you are doing that, be observing the patient face to see whether the patient is feeling pain. You see the facial expression of this patient, right? While you are doing that, then the next thing now is for you to perform percussion, right? By placing the left hand like this on the right hand flank and then tap the left flank with the right hand. This way you percuss and feel. Let's take, for instance, you want to hear the sound around the spleen, right? And then you want to feel the sound around the liver, isn't it? Then you come and tap and hear the sound, right? And tap. Elicits the pressure of ascites, which is what? Confirmed by the feeling of pressure sound. By feeling of pressure sound transmitted to the left hand during percussion, right? So, after when you are done with percussing, this is the last step that you would do. Is it now that we are done doing this, then you cover the patient, you make your patient comfortable and thank your patient. Thank you for cooperating with me. Do not worry. Reassure the patient, of course. Do not worry. Everything is going to be fine, right? When you take your medication, you're going to be fine, right? So, now the next thing is for me to discard my equipment, of course, the stethoscope that I have used, and of course, I have to remove my glove and go and perform hand hygiene before I will come back and document what I have observed during the abdominal examination. Now that I have removed my glove, I have performed hand hygiene. The next thing is for me to record. What did you observe? What did you observe during the abdominal examination? Is there any abnormal sound? Is there any hernia? Are there striae? Are there stretch marks on the abdomen? Did the patient express pain area? Which part of the abdomen that the patient expressed pain? All this you have to document after when you are done. So now I have come to the end of this procedure. Thank you for watching. Do not forget to like, share, and subscribe to my YouTube channel. Share, comment. And in case you want me to do any procedure, do not hesitate. Drop it on the comment section. And Nurse Blessing Clement is there for you. Do not forget, I love you all. And those students that are about to write exams, I wish you all the best. All the best. I wish you all the best. Thank you for watching.